Good morning, esteemed judges and faculty. I am presenting the study which was corneal surface changes in eyes undergoing pterygium excision surgery. So basically, progression of pterygium alters the curvature of cornea, which often leads to the development of corneal astigmatism. In advanced cases, it can lead to significant diminution of vision and discomfort. And in India, the prevalence ranged from 9.5 to 13%. So the aim of this study was to see the corneal surface and topography in patients with pterygium and to draw the comparison before and after pterygium excision surgery. And it was done by assessing the astigmatism and the keratometries in eye with pterygium and to evaluate the corneal topography after pterygium excision surgery. All the patients above 18 years were considered, and any patient which had history of any previous ocular surgery or trauma or any infection, any intraocular inflammation, or any patient which had pterygium but was posted for any other type of surgery was excluded from the study. It was a prospective observational cross-sectional study, and 100 eyes with pterygium were considered for this study. Visual acuity and near vision was done by Snell's chart and Jaggers chart respectively. Keratometry was assessed by the automated refractometer, intraocular pressure by non-contact tonometry, and dryness was assessed only on the basis of tear breakup time. So the age gender distribution mainly in our study denoted that it ranged, the maximum number of patients were from 31 to 60 years of age, and there was male predisposition of pterygium in our region. And the major cases which were operated were of type 2 pterygium, and then it was followed by type 3 pterygium. Then on keratometry, we saw that pre-operatively the vertical keratometry mean was higher than the horizontal keratometry mean, and it was significantly higher. And then post-operatively, we saw that there was significant decrease in the difference of vertical and horizontal keratometry mean. And with time, the difference reduced, and the amount of astigmatism also reduced post-operatively on third week. And for tear breakup time, we assessed that pre-operatively and post-operatively, there was 10% increase in the patients which had tear breakup time less than 8 seconds, and it was significant. So in our study, the prevalence was more towards the middle age to the elderly age, which suggested age-related susceptibility or exposure to the environmental risk due to work or lifestyle. Also, many studies have showed that the prevalence of pterygium increases in linear fashion with age. Like Vinay Nanje et al. Stated that the prevalence of pterygium, which increased from 6.7 plus minus 0.8% at the age of 30 to 39 years to 25.3 plus minus 2.1% at the age of 70 to 79 years. And there was male predisposition in our study, and various other studies have stated the same, that the male disposition, the amount of males were more affected than females in for the pterygium. There was only one study which was on the Chinese, which in rural area, which showed that there was increase in female predisposition. Else all other studies stated that males were more involved than females in pterygium. Astigmatism has been the highlight in pterygium. Pterygium may cause the flattening of cornea to the leading apex. As Maheshwari et al. Stated, an induced astigmatism was explained by several mechanisms, like pooling of tear film at the leading edge of pterygium and the mechanical traction exerted by the pterygium on cornea. And in their study, the corneal astigmatism which decreased from 3.47 diopters to 1.29 diopters, and the mean difference in corneal astigmatism change was 2.18 plus minus 2.34 diopters, which was significant. Wu et al. Found a significant correlation between the differences in refractive cylindrical power before and after surgery. In our study, pre-operative astigmatism, which was significant, was found in 90% of patients, and post-operatively only 10% had significant astigmatism. So the conclusion of this study was that the limitation of our study, that it was a very small size, and there was diverse range of age which could undermine some findings in the ocular surface. However, this diversity in age group should also highlight some common ocular features that is attributed to all ages, like astigmatism, dryness, which reflect the association with pterygium. More studies related to the individual factors are need to be done in our region for better understanding of pterygium and its association.
The astigmatism has improved in almost 90, from 90% it has come down to 10%. So first thing is whether what size pterygium you have taken. Grade 2 you told.
Major cases were grade 2 pterygium.
So what do you mean by grade 2?
Grade 2, when it has encroached over the cornea, it is between the limbus and the pupillary margin.
So when it is between limbus and pupillary margin, so how many? It's and what about grade 3?
Ma'am, when the pterygium is at the pupillary margin, then we call it as grade 3 pterygium.
Pupillary margin, okay.
I'll definitely go through. जी सर, जी सर.
Your paper was basically on corneal surface changes. Your
Yes, sir.
entire presentation, only 2 slides were touching that particular subject. So in future when you're making a presentation, it would be a good idea to just focus on the corneal surface changes after the pterygium excision, like showing photographic pictures and all those things.
So actually our setting doesn't have a pentacam, so we couldn't